Hello everyone, I'd like to introduce myself. I'm Dr. Robert Longstaffe, and today I'll be talking to you about the importance of Pan Am Clinic and its importance in terms of making patients live their life well. First though, I would like to take this opportunity to thank the countless frontline staff and healthcare workers for their tireless work and the risks that they expose themselves to every day in the care and betterment of patients during this trying time of COVID. So why is Pan Am Clinic important to you? Well, you really need to look no further than the fact that musculoskeletal conditions are the #1 contributor to disability worldwide. 1 in 8 Canadians will be affected by musculoskeletal conditions in terms of chronic pain or disability. So this essentially means that almost everyone here watching will be either directly or indirectly affected by musculoskeletal conditions. When we look at some of the more commonly played sports amongst adolescents, upwards of 44% of patients are either diagnosed with a concussion or brain injury. And certainly this is a truly staggering number. So what is the Pan Am Impact? Well, the Pan Am Impact really examines the pathologies and injuries in all walks of life, from sports-related concussions in the adolescent hockey player, to the shoulder instability in the young laborer, to the massive rotator cuff injury in the retired senior. And really, our work encompasses pretty much all aspects of life and society with the goals to improve patient care and well-being. And I think this slide really highlights the staggering volumes of work that Pan Am is able to accomplish each and every year. Upwards of 27,000 minor injury visits each year, with 63,000 sports medicine visits and 24,000 orthopedic visits. Close to 5,400 surgeries are performed each and every year, with 8,500 MRIs performed annually. And so when you look at these numbers, these are truly immense numbers, impressive numbers when you see them. From a research standpoint, in 2020 alone, Pan Am has been awarded 3 prestigious awards, has been published 29 peer-reviewed journal articles, and has 50 ongoing current studies. Along with this, Pan Am offers community outreach programs that include the Medical Careers Exploration Program, along with live education programs, for which I will talk a little bit more in detail later on. And so really, how are we able to perform all of this and accomplish this? It really comes down to the concept of a team approach that is ingrained here at Pan Am. Communication between health practitioners is vital, and with a multidisciplinary team approach, we're able to provide an efficient, comprehensive, and collaborative approach that facilitates the optimization of patient outcomes. And so the Pan Am Clinic Foundation strives to enable a healthier community through really 3 core values, which is research, education, and community outreach. When we look at research, I want to take a moment just to talk about some of the research programs that we have offering here. And really, our research programs branch into almost every aspect of patient care and in the understanding of pathology and the treatment thereof. From outcomes of certain surgical procedures to concussion diagnosis and treatment, to biomechanical analysis, to exercise physiology, and to clinical diagnostic capabilities are all currently being examined through Pan Am research. Along with this, Pan Am is at the forefront of surgeon training with respect to simulation programs, and something that I'm really excited about is the implementation of virtual reality training, which I truly believe has the potential to drastically change how we train and prepare our surgical residents. And I think that we're really able to accomplish this through an integrated model that incorporates all programs and departments that are involved in patient care, from the initial injury at the minor injury clinic to the subsequent follow-up in the sports medicine clinic and subsequent use of diagnostic services to the potential eventual surgery and rehabilitation process. Our clinical and research team consists of 11 physicians and surgeons that are actively involved in each aspect of research. Along with this, we have 7 full-time research members with PhDs, masters, and a wide spectrum of training and expertise. And it really is the outstanding work amongst this group that allows us to complete our research. And we would not be able to do any of this without their tireless work, and really congratulations needs to be given to them. Along with this, the David and Ruth Asper Center enables us to complete our research skills and training, along with the biomechanical and return to sport assessments. That is vital for many of our research programs ongoing. And without this center and their contribution, much of this would not be possible. Pan Am truly is a global force as it relates to research, as evidenced by our many collaborations with many prestigious and well-known hospitals and institutions around the world. Within the last year alone, over 29 peer-reviewed articles have been published in some of the highest impact journals, along with 50 ongoing current studies that will hopefully be published in the near future. But I think we need to look no further than the honor that was bestowed to Dr. Peter McDonald and the Pan Am research team within the last year with the awarding of the 2020 Neer Award. This award was named after Charles Neer, who is really one of the true pioneers of shoulder surgery, and was given by the American Shoulder and Elbow Surgeon Society for Pan Am's work on 2 different surgical techniques for the treatment of shoulder instability. This is one of the most prestigious awards worldwide as it relates to shoulder surgery. And as the Free Press accurately notes, it really is the Stanley Cup of research. And it truly is remarkable to see that Pan Am is recognized on this level for their work. And so who am I? Well, I'm the newest orthopedic surgeon that has been fortunate enough to have been hired to work alongside this outstanding group. I was born and raised in Winnipeg, Manitoba. I completed my orthopedic residency here at the University of Manitoba. Following completion of this, I completed an orthopedic sports medicine fellowship at the University of Western Ontario with the Fowler Kennedy Sports Medicine Clinic. Upon completion of this, I completed another orthopedic sports medicine fellowship at the Stephen Hawkins Clinic in South Carolina. And then finally, I completed an adult hip and knee reconstruction fellowship here at Concordia Hip and Knee Institute. My surgical practice consists largely of open and arthroscopic reconstruction procedures for both the knee and the hip, but largely focused on the knee. I also perform both total and partial knee replacements. But my main passion, I would say, involves soft tissue reconstruction from simple to complex reconstructions around the knee, from ligamentous reconstructions to cartilage restorations to osteotomies, which are limb alignment procedures. Along with this, throughout my training, I was fortunate enough to have a vast exposure to a variety of sporting teams, from high school to collegiate to semi-professional to professional, for which I learned immensely, and I hope to translate some of my experiences to provide a positive impact for patients at Pan Am Clinic. My research interests are variable, but I would say that my main interest is focused on the knee, and in particular ACL injuries, as it relates to the biomechanics, performance, return to play, and clinical outcomes. And so now I would like to talk a little bit about the education that Pan Am has to offer. The Pan Am Fellowship is an internationally renowned fellowship. Since 1993, Pan Am's had over 55 orthopedic sports medicine fellows that have been trained from all across the world. And we have a wait list upwards of 2023. And with each fellow that we train, I do truly believe that this expands Pan Am's influence and footprint across the world and country. Currently, we have 4 orthopedic sports medicine fellows, as well as 1 primary care exercise and sports medicine fellow, that each have been great additions to that Pan Am team for this year. And now I'd like to talk briefly about the community outreach program that we have here and its importance to Pan Am Clinic. One of the programs that we have here is the Medical Careers Exploration Program. Now, this program is a great program that's offered to inner city and Indigenous youth that provides an exposure to a number of medical fields within Pan Am, which has been ongoing for 12 years, and we have over 50 graduates, and has truly been a success to date. Further to this, Pan Am also offers live educational surgeries that have been broadcast around Manitoba and worldwide. This really is a unique experience that allows students to ask questions to the surgeon while the surgery is being performed, and in turn the surgeon can respond to these questions. It's been a huge success on all fronts. And finally, I would like to thank each and every one of you for your continued support, because without your help, none of this would be possible. And we certainly want to keep this momentum going in 2021. Thank you again.